Welcome back. As the third surge of the COVID pandemic proves the deadliest yet for Ireland, it's a challenging and perhaps unenviable time for anyone trying to run the country. And that task at the moment has fallen to the Fianna Fáil leader and current Taoiseach Micheál Martin, who joins us this morning to answer all your questions on COVID and our vaccine rollout. Good morning to you, Taoiseach.
Good morning, Taoiseach.
And thank you very much for joining us. Are you an early riser in general?
Can be, yeah. I'm actually a night owl as well, though.
Are you?
Yeah, absolutely. Yeah. When I get home in the evening, I tend to do a bit of reading.
Work late into the night.
Yeah, exactly. Yeah.
Do you know
or just do a bit of light reading,
I was thinking last night, and I was saying to the husband that we see you every day on television. We see you doing everything about COVID, mother and baby homes, stuff like that. And I think sometimes we forget that Micheál Martin, the Taoiseach, is also Micheál Martin, the father, the husband. How is Micheál Martin, the father and the husband, dealing with the pandemic, with family, with COVID, with everything that's going on? How are you personally dealing with everything?
Well, I think like most people, adapting and adjusting. I find on a personal level with the family, it's okay. I think, Mary finds the restrictions, challenging and difficult and all of that. But we're into a routine, and the kids have been very good about it as well. They're all into a routine. One of them is in college, two are working. They're working from home, and they're managing that. It's a different world, has been a different world since last March. And I find walking is
that your release?
That's my release. I walk a lot, and I've been doing that for quite a number of years now. So I find that very effective and very useful. And I do a bit of reading as well outside of the work, reading and the work job. But work is all consuming as well, to be honest. So in my sense, because of the nature of the job, it's all consuming. So I'm getting by, but it's different. I mean, we're not. You're not in a cafe, going for a quick lunch or something, or meeting someone. It's very much minding yourself in terms of the restrictions, staying essentially isolated, and bar the meetings that we're having. And we have a series of meetings every day. We're taking precautions in terms of the wearing of masks now, and in terms of just trying to reduce the level of connection.
You just mentioned the restrictions there, Taoiseach, and emerged last night, and I know that Cabinet's not supposed to formally meet to discuss the restrictions currently in place until next week, but it did transpire last night. The suggestion is that the current restrictions we have are going to continue into February, perhaps even beyond. Can you give us some clarity on the matter this morning?
Yeah, I think we wanted to give expectations to our respective parliamentary parties and to the public in general. We will look at this in detail when the Cabinet Subcommittee on COVID meets on Monday, and we get advice from NEFIT and from other sources in terms of where are we now in terms of this current wave and current phase, which is very challenging and very difficult, and assessing the new variant as well and its impact in terms of getting the numbers down. Community transmission is too high at the moment. The numbers are still too high. We need to get the numbers down. We're not anticipating any relaxation of restrictions next week. I think you're well into the next month before we'll be revisiting that.
For all restrictions?
For the vast majority of restrictions, yeah.
And then I saw on my Instagram last night, and a lot of things floating around online last night, that the hospitality, restaurants, nothing will open till the end of May, start of June. And I got a call from one of my friends who runs a restaurant, says, I'm gone if that's the case.
Well, again, I think we have to take it one step at a time. And I think... did you say the end of June, is it there? I mean,
no, I think the end of May, start of June. That was very much end of May, hospitality, end of May.
If we've learned anything, this virus behaves, and evolves and changes. So I think we can't make predictions that far out, but certainly...
But you're not ruling it out.
I'm ruling nothing out in terms of the impact the virus is having. Certainly into the month of February, we don't see any relaxation of restrictions in those key sectors, because we have to get the numbers down. Tonight, for example, is the European Council meeting, and I'll be on that. One of the topics for discussion is the variants across Europe, and what is the impact of the new variants? The UK variant, the South African variant, there's a Brazilian variant. Europe wants greater genomic sequencing in different member states, greater capacity to understand and identify variants early. And what will the impact on the variants be on getting numbers down? If you take the United Kingdom variant, one of the reasons they discovered it is because when they had restrictions in place in Kent, the restrictions weren't bringing the numbers down, and they discovered it was this new variant. So that will impact. That said, on the other side of the story, the vaccine rollout is happening, and that will dramatically change the situation by May, June. we will have a lot of people vaccinated by May. So we will be in a different space then in terms of assessing different sectors of the economy and of society and how we move and how we make decisions in relation to that.
It's difficult not having this solid timeline, though, Taoiseach. This sort of supposition and presumption and suggestion across social media frightens an awful lot of people. People's businesses are at stake. The mental health and well-being of the public is incredibly important right now and is suffering.
It worries me a lot, the mental health issue, the mental well-being issue. That's a concern I have. I've worried that it could be a longer-term consequence of this pandemic and the impact on people. And we'll have to pay particular attention to resourcing non-government organisations in the mental health area so that they're there to help people, help young people in particular, who are going through a particularly difficult period in terms of into the second year now of if you're in third level or leaving cert or second level, your entire life has been upended in terms of what were your rites of passage. And I worry about that a lot. And I think we have to take that on board. But I think the vaccination does give us hope. And so far, even though the volumes are low in terms of the vaccines that are ready, it's Pfizer-BioNTech in the main for the last number of weeks. Nonetheless, we do expect a significant ramping up in March, April, May, June in terms of volumes coming in and administering vaccines at a whole different level. So that will change the situation by mid-year.
We can continue talking about that, but we would like to get some of our viewers' questions in. And let's take our first question from our viewers this morning. And this is Jay Smith. And Jay and Nuala Byrne are both parents of children with special needs. First, let's hear from Jay, who has had to give up work to look after his 14-year-old son, Leon.
My son, Leon, is 14 years old. He has got special needs. He's got cerebral palsy, epilepsy and autism. I have two questions for Micheál Martin. First question is, when will the special needs schools reopen? And the second question is, when will my son Leon be entitled to get the vaccination?
As a parent of a child with special needs, can we not vaccinate the teachers and the SNAs of the special needs classes?
There you go, Taoiseach. Some very valid questions there. A lot of people are asking, specifically with the schools reopening, with teachers being vaccinated, and I suppose rolling it out across all teachers being vaccinated. I mean, can they not be considered essential workers? Can they not be bumped up that list?
Yeah, but first of all, in terms of Jay's question, in terms of special needs provision, we're doing everything we can. Government is of a view that special needs children should be provided for. All of the political parties coming out of the first lockdown said children with special needs and their families suffer too much. And we need to watch out for that in this second or third lockdown. And it's with that in mind that we sought to try and get the schools reopened. We're going to still continue with all the partners in education to try and get provision back into the schools for children with special needs. We're going to continue working on that. In terms of his question about Leon and the vaccination, the vaccination trials to date have been over 18s. So the first priority will be the population over 18 over the next number of months. Some work is underway in terms of Moderna, for example, for 16 to 17-year-olds and 18-year-olds, and that could be a possibility. And the second question there in terms of the SNAs, special needs assistants, and teachers more generally, right now the priority has been residents in long-term care facilities, nursing homes and their staff, and frontline healthcare workers. By this Sunday, next Sunday, we aim to have every resident and all the workers in long-term care facilities vaccinated, and about up to well over 80,000 of frontline healthcare workers. Those are the two key priorities. Okay. After that, then, we move to the over 70s. We want to get all healthcare workers done, and then over 70s. Why? Because the vaccines have been proven at the moment to reduce mortality and to reduce serious illness. And that's why we're focusing, in accordance with clinical advice, on older people and those in the front line.
Just getting back to the parents of children with additional needs, we were chatting to Carol Lennon just a few minutes ago. She is a mum of 5, 4 of whom have autism, 3 of whom are currently in secondary education. Carol was saying she has to wear a variety of hats. She is carer, a teacher, physiotherapist, speech therapist. Here's what she had to say. I'd like to show you.
I need my support, and I don't have them either. So everybody in the house is suffering because everybody in the country is suffering because of the pandemic. But in carers' homes, everybody in the house is suffering because we don't have supports. We can't link in with anybody. There is nobody to link in with.
I would accept that. I'm not disagreeing with what Carol has had to say. It's an extraordinary burden on her shoulders and families in similar situations. And that is why we want to get provision for children with special needs and also childcare for people who are, for those who are working in essential services. And also we're not, as the earlier question, when the volumes of vaccines increase, and they will from the end of this month on, particularly if the Oxford AstraZeneca vaccine gets authorization, we're in a different situation then, and there will be more and additional doses of Pfizer-BioNTech coming on towards the end of this term, quarter one, and certainly ramped up in quarter two. So then we will look at that issue of people in frontline services, particularly in an area like special education. We can't make commitments right now. The priority has to be those in the older age group, because once we get that category done, your mortality starts coming down, your serious illness starts coming down, your pressure on hospitals starts coming down. And so there is light at the end of the tunnel here, and we just have to stick with it.
But Taoiseach, your priority was always to keep the schools open. And for these people who are, and for so many people watching in this morning, when are the schools going to reopen? When can we see this? Like, not even schools for special needs, but in general, the schools. So you're saying the end of February now restrictions are going to stay in place. Does that mean the end of February, schools will not reopen until the end of February?
When I say the end of February, we're talking about generally the sectors like hospitality and retail, and we haven't made final decisions on that. Schools will always be looked at separately, as will construction. They were always regarded as essential services. But that said, given the numbers are very high at the moment in community transmission, so we'll be examining that next Monday in terms of the education situation.
It's getting very divisive now between the government and unions about the school reopening.
Well, I think there was a shared objective with the unions and the government to open for special needs education, and that was articulated well over a week ago by both the unions and the management groups and so on, that they did share a common objective to have our schools open for children with special needs. I think it's fair to say that there's a general anxiety out there and fear around the virus right now, given the high levels of community transmission. I think that's feeding into the debate. I mean, I think there's up to 16,000 people, teachers and SNAs on the webinar last week with the public health doctors. That illustrates the depth of not just interest, but genuine concern that I have technologies out there. That said, well over 10 days ago, all the partners met in education and said, look, we want to open for children with special needs. A lot of issues were raised, were responded to by the Minister for Education, from medical grade PPE, right across to a whole range of supports that might be necessary for certain teachers in certain circumstances. That work will continue between the Minister and the various partners in education. But it is a very, look, my first job in life was a teacher. I'm passionate about education. To me, it's always an objective that we look after children, because this is your one chance in life. It's a great leveller. It's the real weapon of opportunity, if I like.
Parents and carers deserve it. They want answers. They deserve them. You mentioned vaccines earlier on, Taoiseach, and this second question that we have here now from one of our viewers relates to that. This question's coming in from Anne Finnerty. She's a nurse. She's working on the Frontline at Merlin Park Hospital in Galway.
My name is Anne and I'm a Frontline healthcare worker. My question for the Taoiseach Micheál Martin is, why has he not delivered on the rollout of the vaccine to the frontline healthcare workers right across the country? Many frontline healthcare workers have yet to receive vaccine, yet it seems okay that those non-patient contact and non-frontline within our hospitals nationwide have received vaccine. Until we have our frontline healthcare workers vaccinated and immune to COVID-19, we will not get our hospitals back to functioning as they should.
Yeah, well, I could just say to Anne that the priority is frontline healthcare workers and the residents in nursing homes and those who work, frontline workers in the nursing homes. If you take the first 80,000 vaccines that were delivered, up to 70,000 were to frontline healthcare workers. And the protocols that, when the vaccines were given to the hospital groups, the protocols very clearly said patient-facing frontline workers should be the priority. Now, we do have some non-nurses, non-doctors, people who work and who are in and out of theatres as well. You have receptionists who meet patients coming in, and some of those were also vaccinated. Bottom line is we don't have enough vaccines yet to do everybody. We estimate there's about 150,000 frontline healthcare workers out there at the moment, in the system, and we're well over half of those vaccinated by Sunday, and we'll be doing them after Sunday, after the next week. They're next in line, because we will have the vast majority of the residents in nursing homes vaccinated, bar those who may be in outbreak situations where the vaccination teams can't go into a nursing home. But the bulk their first dose will be over next Sunday. And just to give you an example, just to illustrate the point, we would have received about 152,000 vaccines into the country at this stage. By Sunday, we will have administered 146,000. So there's nothing in the tank. I mean, the vaccines that are coming in are going out. The issue is we're not getting our vaccine in because of the supply.
And is that supply going to continue to be slow?
That's going to grow.
I know with the AstraZeneca, but can I just ask you?
Yeah.
We had one of our contributors. We got a huge response to Catherine Layden last week. She's in her 70s. She's living on her own. She's so lonely. She's terrified of catching COVID. And one thing she said to us was, if I got a date, if somebody said to me, it's going to be 6th of March. She said, that is something that I could look forward to, it would keep me going. Why can't we give people like that date?
Well, we will be able to give people, the sequence, we will be able to do that. I think there's a reluctance within the system because of the supply situation. If I gave you a date for 2 weeks' time and then Pfizer-BioNTech say, well, actually, we can't give you the week's supply.
But she was saying March would be fine for her. And so March, even if it was brought forward because AstraZeneca.
But Catherine's over 70.
Yes, she's in her 70s.
She will be in line by March for a vaccine.
So I can tell her that.
Well, yeah, that's... No, but
nobody's told her that. You see, she's onto her GP all the time.
For a good reason, because we want AstraZeneca authorised. AstraZeneca hasn't been authorised.
It would due at the end of this month to be authorised?
29th. Okay. Once that happens, we're then in a position to really ramp this up. Okay. And also to give a comprehensive presentation to the public, which we will do.
So people have a timeline then?
Yeah. Okay. Right. And then that will be followed, hopefully, the month later with Johnson & Johnson vaccine. But also Pfizer-BioNTech then, their volumes start increasing. I mean, they cut back this week. So if we'd given people dates this week, we'd have had to readjust them because Pfizer changed, because they're now going to try and improve their capacity. So they're changing the alignment of the factory or whatever, the structures of their factory, the manufacturing plant, which basically means we're down this week. We'll be back up next week, and they will be increasing their supply to the country towards the end of Q1 and right into Q2. Then their numbers go up again because we bought more of Pfizer-BioNTech. Okay. By the latter part of the first half of the year, we will have plenty of vaccines coming in. The issue then will be the administration of them.
Let's just get to another question. In March, when much of the country was closed due to COVID, Catherine Hanratty from Cavan lost her job as a makeup artist and had to sign on for the pandemic unemployment payment. Here's her question.
So my question for the Taoiseach is, do you really think it's fair to ask people who have lost their jobs due to the pandemic to pay back thousands of euro, especially seeing as some TDs last year received a pay rise? Where do you expect people who can't work to get this money from? This is going to break people that are already at breaking point.
Yeah, well, first of all, the pandemic unemployment payment was brought in as an exceptional income support measure. I mean, all the measures we brought in have been quite extraordinary because of the global pandemic. And the income tax thresholds haven't changed more generally. So, but I think special measures have been brought in by Revenue and by Finance to ease any burden that may be there on people who may have a tax liability because of the overall income situation, that they wouldn't have to pay it all straight away. I think the numbers are very low, it seems, from what we've learned, but we will be keeping that under review. But I think the broader tax threshold is there. If you go above a certain threshold, as you know, you pay a bit of tax. But to be fair, I think we have intervened in the economy in an exceptional way. The pandemic unemployment payments are, way above the normal unemployment payments that we would normally expect. We're doing that to try and keep the economy going and to try and support people through what is an unprecedented global event. And we will continue those supports.
could we just get to another question, because this is a question that actually a lot of our viewers got in touch with yesterday. So many of them have actually asked the same question. They're asking, should we have closed our borders to stop the spread of the virus? And Marion from Kerry, who's worried that too many people are not observing quarantine when they arrive into Ireland from abroad. And Marion's dad is just recovering from cancer. Have a look.
I would like to ask Micheál Martin how he can allow the airports to remain open. There are loads of people entering our country on a daily basis from highly infected areas, and most of us are adhering to the 5K.
Yeah, well, we're saying to people, do not travel into Ireland, and we're saying to Irish people, do not travel unless it's for essential purposes. We have now placed an obligation on people coming into the country that they must have a negative PCR test prior to coming into the country, and that if they don't, they're liable to a fine or indeed imprisonment. The evidence to date now on that measure, since it's been introduced, has been overwhelmingly people adhering to that. But they must also then do further tests after being 5 days in the country and quarantine or isolate for 14 days. We are keeping this under constant review in terms of any additional measures that we need to bring in to ensure that we reduce risk as much as we possibly can. And one of the difficulties is, obviously, in terms of when we banned flights in from the United Kingdom when the UK variant issue surfaced just around after Christmas, people still started flying into Northern Ireland and into Belfast. So there's an opening there, and there's a gap in our system there. I know that the Minister of Health is in touch with his counterpart in the United Kingdom, and there's ongoing contacts there. Ultimately, just exploring avenues in terms of a two-island strategy. But it's not as simple as simply banning all travel,
but Taoiseach,
because there are logistical issues as well in terms of following through on quarantining, but we're not ruling anything out.
But Taoiseach, I can just ask you there, we are very concerned about the UK variant, and you close those flights immediately. There's concern about the South African and the Brazilian variant, and yet 1,500 people arrived in from Brazil in the space of 2 weeks, and the health minister just said to them, well, would you mind quarantining for 2 weeks? Who's going to do that?
Well, no, you see, first of all, a lot of those people work here.
But they came back in.
Yeah, but I mean, they probably went, we were assuming some went back out home or whatever, and that is a worry. And there's huge follow-up on that now in terms of contacting those who did so to isolate and to come forward. And quite a number have come forward and are being assessed and so on. But that is a challenge, that is a difficulty, because we're not, we're a very global country and have been globalised over the last 30 years. And even when, for example, we banned traffic from the UK, rescue charter flights had to be put together by the government, and you suddenly get an insight into the type of ongoing activity between Ireland and the UK, for example, people in Britain for a whole variety of family and personal reasons. And it's not as simple as we sometimes would like to project it. The traffic has gone way down. I mean, international travel is over, really, bar very small numbers. But it still is, I mean, I'm not underplaying it. I do think there's an issue there that we have to keep very vigilant on.
Taoiseach, I think it's extremely obvious from just the few texts we managed to get through this morning, but the mood of the nation is extremely low at the moment. We've been told all along that we need to learn to live alongside the virus. We're not, we're just existing. No household is getting on fine. Everyone's struggling. Do you appreciate and get that people are really in a bad state over this now?
I do, absolutely. We all do. I mean, you asked me earlier, I haven't been in my brother's siblings' houses for a year.
So it's
Actually, I haven't met one of my brothers. We have on the phone a lot because he'd be worried, in terms of, everybody's concerned about their own family situations. They've got elderly relatives and so on like that. So it is very fraught, and it's an unnatural state for humans to be in, where we are now. But I think we just need to stick with it, because I do think there's light at the end of the tunnel. I genuinely think that, notwithstanding the fact that this virus is evolving and is deadly and dangerous. I do believe there's light at the end of the tunnel. I think we can get there. And, the springtime is coming, which I think will give us a bit of an opening in terms of people getting out there. Certainly the seasonality isn't helpful.
It's not helping at the moment. Yeah. Taoiseach, thank you very much for joining us this morning, and thank you for taking our viewers' questions. Thank you.
Thank you very much.
Let's go over.